I'm Mrs. Princey, Associate Professor in Mental Health Nursing. I've got a story of a boy who had a lot of difficulty in focusing in terms of studying, and also he would have difficulty to sit in the classroom or complete his classworks. The teachers usually complained that the child was disturbing the other children in the class. He would hide the answer sheets or report cards and would not inform his parents about his status in the academic performance. As the child aged, this aggressive behavior also increased in the child. If the parents scolded him, he would shout back or bang the door with lot of anger and would cry loudly. And he had this poor sportsmanship. If he would lose any games, he would throw a lot of temper tantrums and used abusive words towards the other people who involved in the games. He displayed emotions such as being very much jealous or being very much possessive. He always wanted to have this branded clothes and also expensive gadgets. At times, when the parents realized, in his bag that he had expensive gadgets, okay, that was not being gifted by the parents, he would just lie to them that, it has been given by some other person to him as a gift. So he had this behavior of lying, stealing, and also he used to tease and trouble even the stray dogs. He was very poor in the academic performance and had no known fears, right? So this is the story of a boy. So by understanding this behavior or the characteristics of this boy, you can understand what is the diagnosis or what can be the type of the personality the child is having. Yes, the child is having an antisocial personality, or you can say he has a problem in his character or the conduct, right? So the disorder which I'm going to talk about today is about the conduct disorders. You can notice these things in the children, okay, wherein these kind of a behavior can be noted. They end up with being very much antisocial or having the conduct disorders. So what is the hallmark of conduct disorder? Aggressiveness is the main hallmark of the conduct disorder. The child with this kind of the disorder often fights, bullies, intimidate others, and involves in various kinds of the assaults, especially the physical as well as sexual assaults. He has got a very poor relationship with his friends or peers as well as the adults, or you can even say the family, and he always violates the rights of others or the social rights. He doesn't follow the rules and regulations of the society and always violates the rights of the society. His behavior has lot of interference with his performance in the school or at work. That is, he is having a very poor IQ or academic performance seems to be very poor. Because of which, since he fights, his academic performance is very poor, he lacks the attendance, right? He may be expelled from the school or even he may have problems under the law. So because of such a kind of the behavior, when he is not able to follow all these rules or is having unacceptable kind of a behavior, he may be just removed from the home or put out of the home, where he may require the foster families or some other homes where even there he does the same thing. So thus he will complicate his whole life. So that is the overall characteristic feature or the concept of the conduct disorder. Let us see the epidemiology of the conduct disorder. You can note that the prevalence of the conduct disorder is about approximately 1 to 4 percentage in the age group between 9 and 17 years. It is more commonly seen in the male gender. The onset of the disorder usually happens before 18 years, with the early onset around 10 years of age or before 10 years. So such kind of the disorder has got a worse prognosis, and such a child will be having the antisocial personality as a child. So they are termed as antisocial children. So such a kind of antisocial children later on will develop the antisocial personality, becoming antisocial adults. So it is found that about 25 to 50 percentage of the antisocial children become the antisocial adults. So this is the epidemiology of the conduct disorder. Let us see what is the consequence of the conduct disorder. The being antisocial child. Okay, the child may be at risk of developing so many other conditions, or he may end up with lot of consequences having this conduct disorder. So what are those? Number one, they may develop sexually transmitted diseases, rape, teenage pregnancies. They may end up with the injuries or substance abuses, depression, suicidal thoughts, suicidal attempts, as well as suicide itself. So these are the consequence, or the complication of having a child with the conduct disorder. Moving on to the cause. So what is the reason of developing the conduct disorder? Basically, we have got the biological factor as well as the psychosocial component. So what is the cause? Number one is the social risk factors. There are various social factors which can predispose for a child to develop this kind of a conduct disorder, especially if there is early maternal rejection. Okay, so during the earlier stages of the development, if the child lacks the maternal affection or the motherly bond, okay, there is a rejection from the mother, right? So such a child is at risk of becoming or developing the conduct disorder. If the child was separated from the parents with no alternative caregivers who are available, so such a child will develop the conduct disorder. So they will lack a lot of guidance or affection or emotions which actually a child requires. So when the child is not getting his emotions, love, care or affection or guidance from an appropriate parental figure, obviously he will end up with the antisocial personality. Another social risk factor is the early institutionalization. So when there is a lack of parent, or when the child becomes abundant, so such a child will be placed in adoption homes, or they will be placed in the orphanages. So such kind of, during the earlier stages, if they are into institutionalization, such a child may develop the conduct disorder. Other social risk factors such as family neglect, abuse, or any kind of the violence which is happening in the family can have an impact on the child. Frequent verbal abuses from the parents, teachers, or other authority figures. If the child is undergoing frequent, abuses verbally, the child will become or will develop such a kind of a hatred, such a kind of a reaction wherein he can end up getting this kind of the behavior. Apart from it, if the parents are suffering from any of the psychiatric illness, or if they are having this substance abuse kind of a behavior, marital discord, lot of hostility between the parents, all these contributes to the conduct disorder. Large family size, crowding, poverty also contributes to the child to develop the conduct disorder. So these are the various social factors which will influence the child to develop the conduct disorder. So we have got the other risk factors which can also contribute, especially the biological or the physical factors. If the child has got any kind of the neurological disorders or neurological abnormalities which happens because of being born with the low birth weight, having any kind of the birth complications, so such a child later on may develop the conduct disorder. Or a child who is having under arousal of autonomic nervous system, a child with a learning impairment, and if the child is having insensitivity towards physical pain or punishment, okay, you impose a lot of punishment on the children which causes physical pain, the child becomes very much adamant. Right? So such kind of a conditions can also predispose a child to develop the conduct disorder. Moving on to the signs and symptoms. So what are the signs and symptoms of the conduct disorder? Number one, fighting with the family members or the peers. speaking to others in a nasty manner. So you know what is the story which I told you about a boy initially, right? So he even used to tease the dogs, okay, and also he used to be very much adamant. He used to be very much disobedient to his parents. He used to show the aggressive behavior. The similar signs and symptoms here also that you can note, that is being cruel towards the animals, vandalizing or destroying the property of the other person, cheating in the school, skipping the classes, smoking cigarette, using drugs or alcohol, having this habit of stealing or shoplifting, engaging in precocious sexual activity, and abusing others sexually. So these are the signs and symptoms that you can note in a child who is having this conduct disorder. How do you diagnose the condition? So to diagnose the condition, you may require a complete team approach. You may require the help from the parents, help from the teachers, help from the other personnel to diagnose the condition. So you require a medical and psychiatric evaluation that has to be done. You're going to get a feedback from the parents. You're going to consult the school personnel or the school teachers regarding the behavior that the child used to. You may even require probation officer's report, because such kind of children will have this antisocial behaviors which are not reported. So you may require a team approach to diagnose the condition. Apart from this, you're going to have an educational assessment done to determine if the child is having any kind of learning related problems, academic performance, problems with the intellectual ability. To know that, you're going to do an academic or you're going to do an educational assessment. If the child had any history of head trauma or seizure, you're going to undergo a neurological examination for a child. So these are the various diagnostic evaluation, or how you're going to diagnose the condition. Now, moving on to the treatment. So, what is the mode of treatment? The treatment is very much difficult. Most of the time, such a child requires a treatment by placing him in a corrective institution. Various methods such as behavioral modification, educational or psychotherapeutic measures are required to treat the child. Otherwise, we are not having any fixed, psychopharmacological agents to treat the, conduct disorder, unless and until the child has any other conditions such as, epilepsy. You're going to put the child on an anticonvulsant drug. If the child is hyperactive, you're going to put him on a stimulants. If the child is having difficulty in controlling his impulse, that is, he is having an impulse control disorder or episodic aggressive kind of a behavior, you're going to administer the drug lithium or carbamazepine. If the child is having the psychotic features, you're going to administer the antipsychotic group of drugs. So based on the condition of the child, you're going to administer the corresponding drug. Otherwise, for treating the conduct disorder, we don't have any such drug. Only thing is, you're going to put him in a corrective institutions or corrective homes. Apart from this, you're going to counsel the parents, you're going to educate the parents how they have to deal with such a kind of a child at home. The parents should be taught to reinforce the behavior when the child is showing right behavior, to positively reinforce it. When the behavior are not accepted, the parents have to, there is no other way that they have to make the child to undergo harsh kind of punishment so that the appropriate behavior the child will develop. And also, parents should be taught how to develop such kind of an emotional bond and show their affection towards the child, which is very, very important. At times, when the behavior cannot be controlled such an extent that the child may end up with the antisocial kind of a behavior, then you may require a juvenile justice system in place so that the child's behavior can be modified, wherein you put the child in a structured environment wherein there are rules and regulations are followed, and also there will be personnel who will be monitoring and controlling the behavior of the child. So this is the treatment of conduct disorder. Moving on to the nurse's responsibility when such a child is there in your particular childhood psychiatric ward. So what is your responsibilities? I've got some nursing interventions. The first and foremost important thing is you're going to convey to the child that he or she is accepted exactly as he is, and you're going to develop that trustworthy relationship with the child so that the child will cooperate in your play. Provide a clear behavioral guidelines to the child. So you tell him, you teach him this is what is the accepted behavior, you guide him to follow. If the child is not following the guidelines, or if he's showing a manipulative kind of the behavior, that he has to pay for it, he has to face the consequences. You're going to inform him prior and inform him about the guidelines that he has to follow. Talk to the child, make him realize how to make the acceptable choices, teach him the effective way of problem solving, help the child or assist the child in analyzing the personal needs of the child, and also the best strategy that he can do for meeting his needs. So, how he can meet his need? It's not that he has to go in a negative way to get whatever he wants. No, teach him the strategies that he requires to follow, that he gets what he wants, that he fulfills his needs or wishes. As a nurse, you're going to identify those abusive communication or the abusive words that the child will use when he's communicating, in terms of threatening communication, sarcasm, teasing, disparaging comments, and also you're going to encourage the child to stop such kind of the abusive communication. As you know, this kind of children will be very much aggressive. Okay, they need to channelize this aggressiveness or frustration in a positive way. So teach them the ways wherein they can constructively use this aggressive or frustrative kind of feelings, and help them to release these negative feelings by involving them in various activities in a constructive way. As a nurse, you're going to monitor the child for the aggressive behavior. Not only monitoring, you're going to see that if the child is internalizing the anger. Okay, that internalization is one of those defense mechanism that he uses, where he internalizes his anger, becoming depressed, or may have the suicidal ideas or suicidal attempts. So you're going to be a vigilant nurse to monitor if he is using such a kind of a defense mechanism wherein he will internalize his anger. Help the child to accept responsibility of his behavior instead of just blaming others or just being defensive, or taking revenge. He has to be molded in such a way that he accepts his behavior, what he does. You can use the role playing wherein the child can witness a similar situation of his, and also practice way of handling the various situations. Like it can be a stressful situation wherein he will gain the skill as well as the confidence in managing the difficult situation or to solve his problem as a whole. Right? So these are some of the nursing interventions that you can plan for a child with a conduct disorder. So a conduct disorder is such a condition wherein the child will have a lot of aggressive behavior, wherein he may start, developing the consequences because of this conduct disorder, wherein he will be not following or not keeping the rights of the society in an appropriate way. Right? So hope you all have understood the topic. Thank you.